My name is Leanne Collins. I'm going to be giving you a speech today. Today my speech is over physician-assisted death. Um, Death with dignity is basically what physician-assisted death is for. When people are terminally ill or they're hopelessly ill, where doctors have said that their diagnosis and their prognosis and their capabilities are not good and they're going to die within a few months, then Death with Dignity allows them to be able to give themselves medication or um, medication in general to allow them to pass away without having to deal with the pain. Limitations of the Death with Dignity Act or the Physician Assisted Death are 2 verbal requests of the patient, 1 written request with a witness, 2 doctors have to agree on the diagnosis, the prognosis, and capabilities, like I said before, and the patient must administer drugs on their own. That's different from euthanasia because euthanasia, the physician is going to give you the medicine. However, on physician-assisted death, the patient administers their own drugs to be able to give themselves the lethal dose to let them pass. So what about the commandments? We have 10 commandments. The 6th one on the screen says, "Thou shalt not kill." Well, objections to that are people shouldn't have to struggle when they're terminally ill. They're going to die anyways. Why not give them the ability to make their own decision on whether it's time for them to pass or not? Because death is inevitable, and life is basically only prolonged by the medicine that they give. Doctors, while you're in the hospital, give you medicine to ease the pain. Do they not? Yes. Well, this medicine only allows them to keep continuing their life. The difference between murder and PAD, which is physician-assisted death, is murder is unlawfully premeditated killing by someone else. However, PAD is the willful taking lethal dose that is injected by the patient. So the patient knows what they're doing, and they're getting the drug themselves. Concerned that doctors may be practicing without the limitations, like without using the limitations before they give them the lethal doses? Yes, but even now, PAD is happening or occurs now and people don't even know about it. The alternative is that the terminally ill patients can commit suicide. They can kill themselves with a pillow, they can smother themselves, they can take the IV out. There's a lot of different things that can happen where the patient will just kill themselves, and then it's like they didn't even have an option. The families didn't have an option to say goodbye. They were just struggling and the pain was just too bad. An example, if you've ever heard of Dr. Jack Kevorkian, he's a well-known medical pathologist. He's well known for giving Janet Atkins, who had Alzheimer's, and she was given 6 months to live. In the back of his van, he gave her a lethal dose of medication that allowed her to pass easily without having to go through the pain, without having to suffer from Alzheimer's. And Dr. Kevorkian went through many different trials in court because of his actions, but a lot of times he was not charged because nobody really has a say on physician-assisted death. Yes, they think it's wrong. However, a lot of states don't have rules and regulations and laws against it. However, Dr. Jack Kevorkian, he died when he was 83 in June of 2011. In the picture that you see, this is the equipment that he used for Janet Atkins to let her pass in the back of his van. I do not agree with the way he did it. However, the option for her to be able to pass on her own was one that I do agree with. Is PAD already legal? Yes, in Oregon, Washington, and Vermont. There's the Death with Dignity Act and the Patient Choice and Control at the End of Life Act. So again, how many doctors practice PAD illegally? The answers are no because it's a secret. Doctors are given an oath when they first come into being a doctor. Their oath is basically to life, liberty, and the pursuit of life. In the beginning, I didn't agree with PAD, but then one specific lady helped me to change my idea. Miss Dar, when I was about a few years ago, my mom was she helped old people, elderly folks, and she went to their house and she was their companion. She took them to the store. She helped them when they had to go to the doctor. Well, Miss Dar, one of her other caregivers, allowed her to fall, and her knee got scraped. And she went into the hospital, and they found that her knee was infected. And she was too old for her body to be able to fight the infection. So the infection was constantly eating her body, eating at her body, eating at her body. Her body was so weak, then she got pneumonia. So she's sitting here, imagine, on a bed, frail, wrinkly, small, barely able to move, but if you see her move her finger, it's strictly a bone. You had no meat on her body. The pain from the pneumonia and the pain from the infection in her knee was killing her. And she would constantly say, every time I went in there, she would say, Elisa, which is my mother's name, will you walk with me? She wanted my mom to walk with her because she was ready to go. She was ready to go. The only reason why she was still staying there is because she wanted to say goodbye to her son and because she wanted to say goodbye to my mother. She wanted both of them to be in the room when she was ready to go. Mm-hmm. For physician-assisted death, there are limitations. And there's a right to express when it's time for you to go. Based on Ms. Dar's story and the other reasoning that I personally seen, I'm not sure if anybody else has seen, I believe physician-assisted death is a right that one should choose when it's time for them to die. Physician-assisted death should be legal in the United States because it's a matter of human dignity, and folks fight for it. My choice, my life, at the end of my life. And these are the works cited pages. This is my works cited pages. These websites are ones that I use in order to gather my information, and the images that you've seen came from Google Images.